Before I recognize the distinguished ranking member for his opening remarks, I'd like to recognize Congresswoman Bush for an opening statement. You are now recognized, Congresswoman Bush.
St. Louis, and I thank you, Chairwoman Maloney, for your partnership in convening this historic hearing on the urgent need for comprehensive and universal health coverage in the United States. The committee's exemplary leadership, tireless advocacy, and commitment to genuine health equity will rightfully bring this conversation back to the forefront of public health policy. I must acknowledge the tremendous work and contribution of Senator Sanders and Rep. Jayapal for putting forth the boldest legislative proposal to date, the Medicare For All Act, and to my sisters in service on this committee for their partnership and steadfast leadership in our effort to protect health care as a human right. Thank you to our esteemed witnesses, a comprehensive range of patients and researchers, healthcare professionals who have come together today to passionately advocate for universal health care. Medicare for All is transformational policy change that will implement a national single-payer universal health care system that guarantees comprehensive health care coverage to every person in America and in the for-profit, privatized, broken system we have in place now. I have personally borne witness to the stark inequities faced by uninsured and underinsured patients during my tenure as a registered nurse. For some people, it's hard to imagine rationing expensive medication like insulin, skipping dialysis appointments, foregoing surgical procedures, or refusing medical care entirely. People are having to choose between their life or a lifetime of medical debt, and that's not okay. And I know because I'm one of those people. Until I was sworn in as a member of Congress, I was uninsured for over a week. And actually, I've spent the better part of my adulthood lacking access to health coverage, overburdened by medical debt, and unable to receive regular preventative and routine medical care. It shouldn't have taken a job for me to be able to access affordable medical care. Health care is a human right, and we should guarantee it for everyone. Providing every single person in the United States with health care is a powerful anti-poverty mechanism. Medicare for All would help low-income households save over $38 billion annually on medical out-of-pocket expenses like deductibles, co-pays, co-insurance, and self-payments. Research has proven universal coverage will help reduce poverty rates by over 20%. In St. Louis, our communities are facing systemic threats to their health from all angles, from poverty, substandard housing conditions, environmental destruction, overdose and mental health crises, pollution to over-policing. Lack of affordable health care has resulted in millions of preventable deaths before the pandemic, and the situation continues to rapidly deteriorate as COVID-19 claims over 1 million lives and counting. While Democrats have a majority in the House, Senate, and the executive branch, it is imperative lawmakers seize this narrow opportunity now to enact transformational public health policy and poverty reductive policies like Medicare for All. Taking strides towards universal health care coverage is the only path forward to reversing troubling trends in U.S. population health. I urge my colleagues on both sides of the aisle to earnestly consider the lethal consequences of continuing to prioritize big pharma profits over human life and health. Thank you, and I yield back.